Vanakkam, myself Dr. Kavitha and my associate Dr. Shirley Andrews. Both of us are family physicians at Chennai Kaveri. Today being World Health Day, both of us are very happy to be here to share our knowledge to you. So World Health Day. So WHO says a healthy person is mentally and physically fit. So where are we today? Post pandemic, we see a lot of people with health anxiety. So everybody wants to know whether they are mentally and physically fit. So today let's see how one can make ourselves mentally and physically fit. So we usually say, whenever you come for seeing any doctors, they usually say, do physical activity, நல்ல ஆரோக்கியமான சாப்பாடு சாப்பிடுங்க, உடற்பயிற்சி பண்ணுங்க. ஸோ இது வந்துட்டு டெஃபினட்டா எல்லாருமே வந்துட்டு would have known by now. But what is the science behind it? So when you do a physical activity and you take nutritious food, what makes you to feel very happy? What is the science behind this? So that is what I'm going to tell you today. uh, we inborn within us we have certain neurotransmitters and hormones: oxytocin, endorphins, dopamine, and serotonin. So these four neurotransmitters make us happy. So how does it make us happy? So serotonin pathina, it gives us a good pleasure about ourselves. We feel good about ourselves. Dopamine makes us to plan, think, and make our motor activities very well. Endorphin பார்த்தீங்கன்னா some pain in our body. நேச்சுரலா ஏதோ ஒரு வேலை செய்யும் போது ஒரு வலி வருதுன்னா அந்த வலியை வந்துட்டு கம்ப்ளீட்டா erase பண்ணிடும். So those are endorphins. And then finally we have the oxytocin. Oxytocins are like you feel loved, you want to love somebody. So that's these four. If these four neurotransmitters are equal and in a good amount in our body, you will feel very optimistic about yourself. உங்களை பத்தி உங்களுக்கு ஒரு நல்ல ஒரு ஃபீலிங் வரும். சுத்தி இருக்கவங்களை பத்தியும் ஒரு ஹாப்பினஸ் தரும். You'll feel more productive. You will be mentally more happier and cheerful. So why do we lack? So how do we get these hormones? So everything is not easily coming out in our body. So what is the fact behind doing exercise? So when you do an exercise, the exercise induces these hormones to secrete. So for simple example, நீங்க பாத்தீங்கன்னா when you go to the gym or when you go to a spa or when you have a nice oil bath, when you finish that and come out, you feel so refreshed. நீங்க வந்தோடனே உங்க ஃப்ரெண்ட்ஸ் கிட்ட எல்லாம் சொல்வீங்க, yesterday I went for this nice facial, after that I felt so fresh, எனக்கு அவ்வளவு ஹாப்பியா இருந்தது, every week we should do this. Or after coming out of the gym, you'll say, today I felt so happy, எனக்கு ரொம்ப ஃப்ரெஷ்ஷா இருந்தது, I felt the blood was circulating, we need to go to the gym every day. So what is the science behind it? So when you do the exercise, ஒரு சின்ன குழந்தைக்கு நம்ம வந்து எண்ணெய் ஏன் தலையில வச்சு தேய்க்கிறோம்? So that massaging where you do in the scalp makes the blood circulate and also makes all these serotonin, dopamine, and everything to secrete. So the science behind it is once these happy hormones secrete, you feel so energetic, you feel so good about yourself. But whereas when you are sedentary, ஒரே இடத்துல உட்காந்துட்டு இருக்கோம், காலையில நைட் வரைக்கும் ஆஃபீஸ்ல இருக்கோம், there is no sunlight exposure, சுத்தமா விட்டமின் டி நம்ம மேல படலனா, these happy hormones won't secrete. So once these happy hormones don't secrete, automatically you feel low, you feel dull, and then you feel unproductive. So அப்ப என்ன ஆயிடுது? Automatically your stress hormones get released like cortisol and adrenaline. இது என்ன பண்ணும்? இமீடியட்டா வந்து உங்களை வந்துட்டு பதட்டத்தை கொண்டு வரும். ஒரு பதட்டமான ஒரு சூழ்நிலையிலேயே இருப்பீங்க, ஒரு பேனிக்காவே இருப்பீங்க. இது நடக்குமா, அது நடக்குமா, இது பண்ணலையே, நம்ம அது பண்ணலையே, மத்தவங்களோட கம்பேரிசன் பண்ண ஆரம்பிச்சிடுவீங்க. நம்மளுக்கு ஒருவேளை இந்த ஆங்ஸைட்டி வில் ட்ரிகர் சம் ஹெல்த் இஷ்யூஸ், லைக் ஒருவேளை நம்மளுக்கு உடம்பு சரியில்லையோ அதனாலதான் நம்ம வந்து இப்படி இருக்கோமோ. ஸோ ஹெல்த் ஆங்ஸைட்டி வில் ஸ்டார்ட் கம்மிங் பிகாஸ் cortisol has the effect. என்ன எஃபெக்ட்னா, once cortisol becomes high in your body, it triggers the liver to secrete more glucose. So once the gluconeogenesis ன்னு சொல்லுவோம், increase glucose ஆகும்போது stress induced diabetes, stress induced blood pressure, cholesterol, பதட்டம், palpitation, weight gain, obesity. So cortisol again makes you to become fat. உடல் பருமன் ஜாஸ்தி ஆகும். So once obesity வந்துச்சுன்னா, that's more than enough to make you to get into a metabolic syndrome. That is obesity. நம்ம உடல் பருமன் அதிகமாக அதிகமாக we are candidates for pre-diabetic, hypertension, heart disease. So ஒன்னும் அப்படியே நம்ம கூட friends மாதிரி அப்படியே சேர்ந்து வந்துடும். So to avoid that, that is why everybody says physical activity பண்ணுங்க. But on World Health Day, what I want to tell you is nothing comes just like that. So ஒரு 5 வயசுல வராதது 50 வயசுல வரப்போறது இல்ல. So as a good parent, I feel this particular health issues should be addressed in childhood. So of course, middle age people, old age people, please start at least, we should start at least now, but at least from now on in the generation, post pandemic, where the children have been in the house for 2 years. So pasanga வந்து actually they are the happiest of everybody because அவங்களுக்கு there's no commitments in life. But அவங்களே இப்ப வந்து they are very stressed. They are sitting in the house without seeing friends, without going to school, no sunlight exposure. So even children have been becoming more mentally upset. So the first thing is, as a good parent, we should make all our children to do good lifestyle modification, நல்ல sunlight exposure, நல்ல exercises, and finally good nutritious food. So health education comes with diet education and sex education. இதெல்லாம் as a good parent we should teach our children, and so that what we see at 70s now we are seeing at 40s. What disease we used to see at 40s we are seeing at 20s. So at least இனிமே வர community, இனிமே வர பசங்களாவது ஹெல்த்தியா இருக்கணும்னா it is our duty to make sure that we follow certain simple principles of lifestyle modifications. So with this I say a goodbye to you, and now I move on to Dr. Shirley Andrews, who will enlighten about how to keep our physical fitness well, and also enlighten about how the annual health checkups are very important post pandemic. Thank you.
Thank you so much, ma'am, for that lovely explanation you gave. I think it's very perfectly put. Basically, enna how you are mentally, how it affects your health. So mind over matter and so on. Yeah. So how important it is to have those happy hormones going, and adu vandu it's as you said, World Health Organization or a definition of health itself is it's a state of complete physical, mental, and social well-being, and not merely absence of disease. So
Yes.
only a disease illana we are healthy என்றது கிடையாது. It should be in a complete state of healthiness. So that is what WHO also defines health, and today being World Health Day, we are both very happy to come forward as family physicians of Kaveri, who want to talk to you about this very important thing. And as ma'am said, mental health is extremely important. We have to balance the mental health with the physical health. And physical health, we've all heard many times our doctors telling us eat healthy, sleep well, avoid alcohol, avoid smoking. And the mari we have been told time and again, and it's just become like part and parcel. But there's a lot of evidence behind this, and especially in the post-pandemic era that we are dealing with, and work from home lifestyle nala, lot of habits have been missed. So a lot of healthy living basically means you have to follow healthy habits. In my opinion, that is the most important thing. And healthy habits have been taking a toll ever since the COVID pandemic struck. So we need to really work on the healthy habits. And very interestingly, researchers from Harvard Public School, they have done a huge study in which they followed a large number of people over a period of time, trying to see how the healthy habits will affect their life expectancy. So they are mainly dealt with 5 important areas. So in the 5 important areas, ennan pathina, diet, physical activity, keeping your body weight in the correct range, and avoiding alcohol or avoiding smoking. Avoiding smoking means no smoking. So no smoking is permissible. Alcohol vandu permissible limit la you can take. When it comes to diet, there are a lot of things that have changed in this post pandemic era. So ennan pathina, we are more into fast foods, and we are more for easy access of foods. Ideally people should cook food at home, and the eating out should be once in a way. Ipo ultava vandu people are mostly buying from outside and eating at home is once in a way. So that kind of mentality has to change. Working people should have a plan on a weekly basis how they are going to manage their food throughout the week. And to be very basic, if you take a plate, we need to split it into 3 parts. Adula vandu 50% of the plate should be our vegetables and fruits and everything which is so rich in antioxidants, as well as so many vitamins and minerals are there in the vegetable part. So that should be 50% of the plate. Remaining 25% நீங்க split பண்ணீங்கன்னா it can be the whole grains, the carbohydrate content. Remaining 25% can be the legumes and proteins. ஸோ இப்படி இந்த மாதிரி பேலன்ஸ் பண்ணோம்னா we can definitely get all the nutrition as well as avoid obesity and other complications. So food and diet வந்து we have to give maximum stress. Of course, physical activity, as madam very rightly said, it has so many benefits, and minimum of 30 minutes to 45 minutes of medium to rigorous exercise as per your convenience is very very much required. And the third important thing is maintaining the BMI. So BMI of 18.5 to 24.9 is the ideal BMI. So if you are maintaining your body weight in the ideal BMI, half your health problems are taken care of. So that is about the BMI. And of course, we talked about the smoking and alcohol. So what the research they came out with, the outcome is that just by doing these 5 key things, your life expectancy can be increased by 15 years. So you can imagine what is the main major impact it has. And out of these 5, any one, just one particular thing if you take up and do, you can increase by 2 to 5 years your life expectancy. So it's not just doctors just want to tell you eat well, exercise, just like on a day to day basis they are just saying that kadiyadu. It is evidence based. Research and studies are showing that these kind of changes if you do in your day to these kind of healthy habits if you follow, you can improve your state of health as well as you can increase the life expectancy. So based on this, I think we have just given you an idea of how to manage your health and how to have a healthy living. And we here at Kaveri are doing a multiple range of health checkups, from minor basic packages to extensive packages. And also what we do is we take the patient and try to analyze what sort of health checkups will be ideal for them, and age to age basis, as well as if they're having any risk factors. If they're having based on risk factors, we can go for particular type of checkups. Of course, age plays a major role. So people who are above 40, accordingly we will be more concentrating on their heart function and on their bone. For especially women, postmenopausal women, we will concentrate more on their bone health and their gynecological health. So it's a overall 360-degree
Yes.
kind of approach that we have here. And we are very much focusing. All our patients are very happy with the way things are going. And mainly we have to be health aware.
Health awareness.
So that is what is the health checkup
Yes.
are all
So
about.
annual health screening, Dr. Shirley Andrews சொன்ன மாதிரி, so you can screen yourself. So you basically we have told you how to keep yourself healthy mentally and physically. Besides this, as Dr. Shirley was mentioning, annually வருஷத்துக்கு ஒரு தடவையாவது you can come and screen yourself for basic blood parameters. As she says, all the blood parameters will say whether your thyroid is functioning well, whether you're anemic or not, whether your liver functions are normal. Long term hypertension இருக்கவங்களுக்கு வந்துட்டு renal function test, so urine microalbumin, all that will be covered. And for above 40, as Dr. Shirley has rightly mentioned, your echo and your TMT can be on a regular basis, so that your whether if you have a family history of heart disease, so அவங்களுக்கு வந்து it plays a very important role. The treadmill tells us how efficient and how well your heart cardiac status will be. And of course, again, as she mentioned, above 40, breast screening and pap smears will be done on a regular basis annually. So that these are all certain things where you can screen yourself, and it will tell you where, in case we pick up a problem, it will be easily addressed, so that you can, one, you can prevent the disease. If you're a pre-diabetic, we can give you the lifestyle modifications where you don't have to come into a diabetic range. Unfortunately, if you have picked up with some kind of disorder, we will guide you so that you can have your treatment earlier.
So prevention is better than cure.
So of course, as family physicians, we love to say that prevention is better than cure, and we want a disease-free community. So both of us are here to help you out anytime.
Yes. Wish you a happy World Health Day.
Happy
And
Health Day.
With that, we will take some questions if so.
I think they're fine.
Thank you.
Thank you.